to 100,000 nurses in England, Wales, and Northern Ireland have been protesting in demand for a rise in their pay. The Royal College of Nursing wants an above-inflation pay increase of 19.2%, but says it is willing to negotiate. The government says that's unaffordable, though. The most recent pay offer represented an increase of around 4%. Up to 70,000 appointments and operations have already been affected, including routine care such as knee and hip replacements and community nursing as well. Patients going to accident and emergency wards are also being warned they will have to wait longer than usual. But nurses say the strike will not affect intensive and critical care, as well as emergency cancer services, children's accident and emergency, as well as neonatal units. We can now speak with an analyst at this time, Global Affairs analyst Gbenga Onifade, and he joins us from the United Kingdom for a deeper look at this issue of nurses striking in the UK. Thank you very much for joining us at this time. What do you make of this? Even the nurses themselves admit it is unprecedented.
Sure. Yeah. Good afternoon. What we have on hand is actually a big deal. The UK inflation is at just falling by 0.4%, so 10.7 from a 40-year high of 11.1% last month or 2 months ago. And it's just not the nurses. It looks like the whole country is gradually, grinding to a staggering halt. We're looking at the barristers who've just resolved theirs, the nurses, the rail workers, the bus drivers, baggage handlers, which is affecting mega airlines. We're talking about Air Canada, Egypt Air. We're looking at postal workers, ambulance staff, even junior doctors, firefighters. So it's not a great deal because it's a big deal rather. But on the other hand, it's not a great deal for the people who will feel it. When I say not a great deal, it's a pain because we're looking at people who are in these areas been affected by a pay squeeze as a result of staggering lifetime inflation. So it's a bit difficult, and the government is looking to meet them in the middle. A pay rise was offered, but at the same time, it's impossible to live at this stage at this rate of which everything is just sky high in terms of the costings.
Absolutely, and the impact, one can only imagine what the impact could be, even though the nurses have said the strike will not affect intensive and critical care as well as some other services. But we hear a second day of strike is due for December the 20th. What are your expectations between now and then in terms of a breakthrough in talks?
Well, it's really difficult because right now the government is being torn torn into different areas because we're looking at the rail sectors, which has been having a progressive talks. Number one, it's a bit difficult right now. It's very too soon to restrict the powers. We've got the rail, you've got the teachers who have been on strike, and also it's not just the nurses. In terms of planned strike actions, on the 17th you got the rail workers, and 18th you got the nurses, which is on the 20th. You got the 22nd, which you got the cleaners from the rail workers. 23rd, again the rail workers. 24th, the postal workers. This is the most crucial times. But at the same time, the government have got to find, they've got to find 18 billion pounds from nowhere, and the government is arguing to the nurses. They're telling them, okay, on average, the nurses are getting about or the public sectors they're getting 4 to 5% in terms of pay, while compared to in terms of how high the pay has gone over years, while the private sector, they've had 6%. So could there be a resolution in the very short time? I don't think so. The reason why is because it could trigger other sectors, who have actually been keeping quiet. But the other thing is, in 1979, the days of Margaret Thatcher, there was a national strike. And, Margaret Thatcher decided to limit the union powers, whereby at some point, the government is thinking, eventually, when all this declines, we might have to stretch our powers. Because right now, if you think about it, yes, even firefighters, they've planned strikes as well. But you have some people who are not allowed to go on strike. You've got the police officers, the prison workers. These guys are not allowed to go on strike. But the key crucial areas, the air ambulances, if you're going to go on strike and it's going to affect the states, but at the same time, the government is turned between a rock and a hard place. We might just have to bear the pain temporarily. That's what I think the government will do by hiring or paying a bit more temporarily to agency staff, but eventually having to stretch their powers while all this inflation is being defeated.
All right. Gbenga Onifade, thank you very much for your contributions on The World Now.
Thanks for having me.